Okay, welcome back everybody to the Tuesday webinar. This is the first webinar of the spring semester. I know it doesn't feel like spring yet. I'm Steve Levitsky. I'm the director of the David Rockefeller Center for Latin American Studies here at Harvard. As always, I'm joined by my amazing co-chair, Professor Francis Agopian.
Hi everyone and welcome. Bienvenidos.
Couple of quick housekeeping items before we jump in. First of all, as always, we'll be recording today's seminar and it will be available on the Dr. Class YouTube channel shortly after the session. And importantly, if you have questions for our speaker today, which I'm sure you will have, we would love to receive it. Just send it through the Q&A tab on the bottom of your screen. After Professor Castro's talk, Fran and I will be fielding questions, and we will harvest questions from the Q&A tab. So at any point during the talk, if you want to send in a question, please do so, and we'll make sure that it gets fed to our speaker. Okay, so one of the main themes that we've had the last couple of years here at Dr. Class is how Latin American governments and Latin American societies are responding to and eventually recovering from this terrible pandemic in the region. And we are incredibly fortunate to kick off this semester with Professor Marcia Castro. Marcia is Andelot Professor of Demography and Chair of the Department of Global Health and Population at the Chan School of Public Health here at Harvard. In her spare time, she also directs the Brazil Studies program at Dr. Class. Professor Castro, in an earlier life before the pandemic, was an expert on the determinants of infectious disease transmission in different ecological settings. She's done extensive work, in particular on malaria transmission, both in the Brazilian Amazon, but also in several parts of Africa. And broadly, her work explores the relationship between infectious disease and a range of other really important processes and outcomes like poverty, urbanization, and environmental destruction. In addition to all those things, though, over the last couple of years, Professor Castro has become a leading public voice on the public health response to the COVID-19 pandemic in Latin America, especially Brazil. In Brazil, which is her home country, she's been a really, really important source of knowledge and reason in the face of a federal government that has at times rejected both of those things. So we are really, really thrilled that Professor Castro taking the time to speak to us. The title of her talk is COVID-19 in Brazil, Population Health at a Crossroads. Marcia, the floor is yours.
Thanks so much, Steve and Fran. Thanks for the invitation. I'm really honored to open this Tuesday seminar series. So I'm going to share my screen in keeping with the topic of paths toward recovery in Latin America. What I want to do today is to talk a little bit about the challenges that COVID-19 has brought to population health, not just because of COVID itself, but because of the way the government handled the response to the pandemic. And I really want to start with this quote, which to me summarizes really what was going on in Brazil and unfortunately in some other countries as well, in terms of responding to the pandemic. So what we had was a complete lack of guidance, reasoning, and leadership from the federal government in responding to the pandemic, which created this a break into the federal, the state, and the municipal level in responding to public health emergencies. So what we had is, in the absence of a federal guidance, we had states and municipality facing the same storm, but not really with the same boat. In some municipalities with much better resources and much better capacity to respond, while others were basically just holding on an oar. They didn't even have a boat anymore. So that really summarizes in a nutshell what was happening in Brazil. A very large country, about a quarter of the municipalities in Brazil have less than 2,500 people. So very diverse, very different abilities to respond to the pandemic. So in the sort of chaos, as Steve just mentioned in the beginning, denial of science, denial of all the evidence that is coming out, propagation of disinformation starting from the federal level. So it's a combination of wrongdoing and not doing what had to be done. This really culminated with a Senate investigation that took months in Brazil, and at the end charged several people in the government or connected to the government. And just the president himself was charged over 9 different crimes, and I list them here. And to me, what's really appalling is to imagine that the president continues to have behaviors that are aligned with some of those crimes, despite the fact that the Senate investigation has exposed all those issues. You might be wondering, well, we had the investigation, and so what? We need the federal prosecutor to move forward with those charges. However, the prosecutor is well aligned with the president, so nothing has happened, and most likely nothing will happen while he's still president. I like to show this study that was done. There are several people that thought about this new concept, including Julio Frank, who is the former dean of the School of Public Health. And they analyzed the case of 2 countries in Latin America, Brazil and Mexico, and came up with this new expression, punt politics, which is basically referring to leaders not taking the action when they should take and putting the responsibility on somebody else. So it's an interesting reading, and I like the fact that it actually compares 2 countries in the region that we all love. So what was the consequence of all of this? How much this brings challenges to population health, and how we can try to take a path towards recovery in order to address all those issues. So first and foremost, if we just look quickly at numbers, and those numbers are already outdated, they are always outdated by the minute, but the key message here is that Brazil and the US have the largest number of deaths. In fact, the US has surpassed 900,000 deaths. And with the Omicron variant, we had the surge in cases in several countries. Brazil is not different, but we are back to observing in Brazil more than 1,000 deaths daily. So that's a situation we hadn't seen since September last year. We're back to this, and most of those deaths are among people who are not vaccinated or have not completed the vaccination regime. What's the consequence of this? So the excess mortality that we observed in Brazil, both in 2020 and 2021, is extremely high. So just in 2020, it was an increase of 15% compared to the deaths we had in 2019. But there is a huge gradient geographically. So we see that it's exactly the states in the Amazon region that had the highest increase in mortality in 2020. The one that is really an outlier is Amazonas. And the capital of Amazonas is Manaus, and you probably all recall Manaus was all over the news. It's the place that ran out of oxygen in the hospital. So it's a 32% increase in the number of deaths just in 1 year. It's even worse for 2021, by the way. So there is a regional gradient, but there's also a racial gradient, and mortality increased much more among Blacks and mixed race compared to whites. Instead, it was the double that it increased for whites. So clearly, everything that I'm going to speak about in here, you can almost bring this gradient, this inequality, either regional or by race and ethnicity or by some other social characteristics. This has been highlighted in several studies. That's just one of them. Again, highlighting this gradient. And I want to emphasize that indigenous populations were also exposed to a much higher both incidence and mortality due to COVID. Now, some groups were particularly affected, and here we can quantify this excess mortality in terms of how much life expectancy at birth was reduced. In here, the darker states are the places that observe the largest declines in life expectancy at birth. compared to 2019. Again, you see the gradient. So Brazil lost about 1.3 years in life expectancy from 19 to 20. Amazonas is the state that lost the highest number of years. It was 3.5. So again, the pandemic didn't play out the same way for all the population and for all the states. If this number is already high, in 2021 is even higher. We had done a preliminary estimate just considering January to April. It was 1.78 years. Just now, as we speak, we are revising those estimates. Pretty soon, we're going to have numbers for all the year 2021. And we're also doing those calculations by educational level. So stay tuned for those results. Now, why is this important? If we just looked at what we would expect the trajectory for Brazil in terms of changing life expectancy, since 1945, Brazil was on average gaining 5 months of life expectancy per year. So here comes 2020, we don't gain 5 months, we lose 1.3 months. So that gives you an idea of the magnitude of this impact. And another way to see this is Brazil, with the mortality we had due to COVID in 2020, goes back to mortality levels that we observed back in 2014. But if you take Amazonas again, we go back to mortality levels of 2006. And if you look at the life expectancy at age 65, then Amazonas lost 2 decades of improvement in life expectancy. This is a huge impact when you think about gains in mortality that we had achieved over the past 20 years. Now, when we consider pregnant women and puerperal women, then the Americas, the region of the Americas, has some of the highest mortality rates associated with the COVID in the world. And this is part of an analysis done by the Pan American Health Organization. Brazil in particularly has reported high rates among pregnant and postpartum women from the beginning, and very early in 2020, we looked at those numbers. We did an analysis of this. And here we can see how the deaths play out by trimester of pregnancy. There are a lot of deaths happening in the 3rd trimester, and there are several reports of pregnancies that have to be interrupted at 32 or 33 weeks because of COVID. So not only we have a high maternal mortality, but we also can have consequences for the baby, for the newborn. The increasing maternal mortality rate in Brazil in 2020 was about 20% in 1 year. And in 2021, the increase was even higher. So if we look at the maternal mortality rate in 2021, it's double of what it was in 2020. So it was a problem. It continues to be a problem in the context of COVID. Now, this has consequences, and the number of orphans that we see, not just in Brazil, but in the entire world, there is a lot of uncertainty in those numbers. There are different groups trying to think of better ways to assess those numbers. You would be surprised or not we don't have really good information systems to allow us to track the number of orphans. And a consequence of that is we still lack a lot of social support programs to be able to provide assistance to those kids that may have lost all caregivers that they could have. Again, this has huge consequences in terms of early childhood development and in terms of the potential human capital of the country. Now, when we think of women, when we think of pregnant women, it's not just mortality, but it's also the violence that has happened. Domestic violence has happened, again, not just in Brazil, but in many countries during the pandemic. And the prevalence of mental health disorders has increased dramatically. We are very fortunate to be following up a cohort of women in one city in the northeast of Brazil, the 5th largest city in Brazil, we're following up a cohort of women that were pregnant during the lockdown period, that had their babies in July and August 2020. And the levels of mental health disorders are about 46% among those women. Pre-COVID, it was up to 25%, between 20 to 25%. So huge prevalence of mental health disorders. And we're just analyzing new data that came from a new wave that we applied a standardized test of child development. And we are observing huge developmental delays in the children of those women. So we need desperately policies that can try to avoid a major problem in this generation of children that were born during the pandemic. The other thing, and again, thinking about the path to recovery, we have a lot of procedures, a lot of consultations that are backlogged. During the pandemic, there were services that were either completely interrupted or that were disrupted. And the key issue here is, what are going to be the consequences of this? What's going to be the duration of those disturbances, and when and how can the health system recover all those procedures that were not done? So here I just bring two examples. One is on diabetes. We have evidence at this point that physical activity has declined substantially among people with diabetes, and about 40% of people have postponed regular consultations and regular tests that they do. So this is really going to have consequences in the near future. In terms of cancer, in 2020, we saw a 36% decline in diagnosis. That's not really good news. If we are not diagnosing, it's because we're not checking, we're not doing screening. And the chances that the diagnosis will happen at a later stage when it becomes much more difficult to control. If we think of mammograms, there was a decline of 50% among women, 52% among women aged 50 to 69 years in 2020 in Brazil. And again, that's about, the estimate is that that's about 4,000 cases of breast cancer that are going to be diagnosed later because of the postponement of the mammogram. I mentioned that the disruption of services in primary care had huge disruption. Community health agents faced major challenges in being able to deliver their work. In a lot of places, they didn't receive protective equipment, they didn't receive training, they didn't receive care. The level of mental health disorders among healthcare professionals across the board, not just community health agents, but nurses, physicians, is very high. The percentage of those that received mental health support is still very low. It's less than 30%. And we have to remember that a lot of those professionals died. A lot of them are not working anymore. This is also an issue in the US. And all of this is happening at a time when the pressure for services is increasing. And we have multiple reports now during this wave of Omicron that there are aggressive attitudes against healthcare professionals because people are tired, because they don't want to be waiting in the line, and because there's no bed in the hospital and they complain about it. So overall, it's a very critical situation on how to respond to this huge demand at a time when healthcare professionals are working not at their limits, but way beyond the limit they thought they had. Now, another thing that we cannot forget when we think about the path to recovery, and I think I'm making a point that this path is going to be a rocky one, is that Brazil is back in the hunger map. And this is just one of the worst news we could possibly have. So in 2020, we had 19 million Brazilians that faced hunger. That's the highest food insecurity possible. And 43 million didn't have enough food. overall, more than half, 55% of the Brazilian population faced some level of food insecurity in 2020. Again, there is a gradient. And here, the northern region has the highest percentage of people that face hunger. And the second one is the Northeast. So this clear north-south divide that is the tone for many different indicators that we look at in Brazil. Now, there are some other policies that also affect health, and they may not be obvious, and I want to bring this in here just to make a point that the path of recovery includes other things way beyond just health. And one of them is the environment. So deforestation and forest fires has been increasing dramatically during this government. In fact, it started to increase 1 year before this current president took term, and it has been increasing year after year under his leadership. Here, what you see, all those white areas are the PM2.5 concentrations. So it's the particles that are being put in the air because of the fires. And here is just a graph that shows you the deforestation rates increasing dramatically over the years, reaching levels that we have not seen for more than a decade. So we completely lost this trajectory that we're having of declining deforestation. Why am I mentioning this? Well, these forest fires and this concentration of PM2.5, every single year, they are associated with respiratory diseases. And in the context of the pandemic, all of those areas that have the brighter red, which are also the ones that had the concentration of the PM2.5, they had higher rates of severe cases of COVID and hospitalizations due to COVID. So here is an example of relaxing environmental policies, completely ignoring the people that live in the Amazon region, and it has consequences directly on a health outcome. Here I bring just a quick reference to a paper we just published last Friday, where we really try to shift the paradigm from responding to pandemics into preventing a pandemic of happening in the first place. And what we say is that there are 3 measures that could be done. So increase viral surveillance, reduce deforestation, and have a better monitoring of wildlife trade. If we invest in those 3 actions, that investment costs less than 5% of the costs we have of the lives lost from emerging infectious diseases every single year, and it costs about 10% of the economic costs that we have due to emerging infectious diseases. So it is a great investment, and probably it's pretty obvious that preventing is better than fixing the problem. And one of the questions is why we're not doing more of this. And I think we could spend the entire discussion on this, but I'll just say one thing. Prevention, when it's done successfully, it's invisible because nothing happens. Nobody dies. And that happens because you're being successful. And this invisibility is a problem. There's no drama, there are no deaths. And as crazy as it may sound, lives saved does not cause the same feeling in people, reaction in people as lives lost. But I'll leave it at that. We can discuss more. Now, one of the ways to find a path to recovery is vaccination. Thank goodness vaccines are there. They work, they save lives. And here, this is the map from yesterday on vaccination in Brazil. These are people that received, the percentage of people that received the 2 doses or the single dose of the vaccine. Now, again, here's a regional gradient. You can clearly see the higher coverage of vaccine are, in the usual places, but the northern region where the Amazon is, you see very much lower vaccination coverage. Just to give you an example, Amapá, right here in the Amazon, has 41.6% of the population eligible to receive the vaccine has done so, while in Sao Paulo, it's 79.6%. So huge gradient in uptake of vaccines. And if you use some sort of geographical lens, you see that this gradient happens at many different scales. And here's the city of Sao Paulo, the largest city in Brazil. Here we see the percentage of the population that has received 2 doses or the single dose. The highest, the darkest color here, this purple, is the people that receive, that has the highest coverage of the vaccine. That's the wealthiest area in Sao Paulo. In the periphery of the city, you have much lower vaccine uptake. This is mortality. And here is the contrast. The lighter areas here are the lowest mortality rates due to COVID. And in the periphery, that's where you see the highest mortality. So it's exactly where you have a highest risk of mortality, with the most vulnerable population lives, that you have the lowest coverage. So again, the gradient happens at the state level and it happens at the city level. Now, the other thing is, we have to think that besides the increase in the demand for health services because of everything that was backlogged, we have long COVID. And there is still a lot of unanswered questions around long COVID, but we have a few studies done in Brazil showing the consequences, the health consequences, some of long-term among people that had COVID. And here I bring a study that was just published online. It says March, April 2022, right? We're, ahead in the future, but it was published online just yesterday. And what it shows is that of the people that were hospitalized in Sao Paulo, in a large hospital in Sao Paulo, they're following up a cohort, and 6 to 9 months after they were discharged from the hospital, there's still a very high prevalence of psychiatric diagnosis and cognitive issues. Just to give an idea, before COVID, among this population, the prevalence of depression was around 2.5%, and among this cohort, it's 8%. The prevalence of PTSD among this cohort is 14%, and memory decline is 51%. So again, think about not just the demand for healthcare of all the consequences of long COVID, but also the consequences for human capital, for the production, for people's ability to work. There's actually an interesting study that I saw yesterday that they were measuring how many times a soccer player passed the ball during a match. And they were doing this analysis for players that had COVID, didn't have COVID. And apparently there is a decline on how many times you pass the ball. But I know this is, we're talking about soccer, but there seems to be issues around cognitive ability among people that had COVID. And the other thing why this issue of long COVID is so important is some governments, like in Brazil, they like to show 25 million people recovered, right? This is crazy to think about this. Having COVID can bring you long-term consequences. So it's not a good deal to have COVID and have a natural immunity. This is completely out of question. But again, we can talk more about this in the Q&A. So what is the path to recovery? And again, what we know for sure is that it's going to be a long recovery. It's very easy to destroy things, but it takes time to rebuild. It's going to be a rocky road. And I think there are 2 things we can say for sure. The first one is the path to recovery must include strengthening the health system in Brazil. Without the health system, without the SUS, we would have about 78% of the population without access to any kind of health services. So I showed you all the inequality gradients we have. without the health system that has the equity as one of its pillars, there is no way we can respond to those demands. There's no way we can address the challenges imposed to COVID, and there's absolutely no path to recovery without this equity lens. So that's one thing that it has to be common sense. The path to recovery has to be through SUS. The second one is the path to recovery has to come through elections. We have elections this year in Brazil, and I think it's pretty obvious for anyone that is really looking at those numbers, that are really looking at the consequences of equity with a touch of empathy and with a lot of touches of science, that the path to recovery must include changing the type of mentality we have in the leadership of the country. It has to involve changing in the government. That's the hope, to make this path to recovery a little bit less rocky. It's still going to be rocky, but a little bit less rocky, with an eye on what is the right thing to do, thinking about delivering things with equity, which is exactly what Brazil needs right now. So I'll leave it at that, and I'm looking forward to the questions.
Thank you, Professor Castro. Just to clarify, the study about the soccer pass, was that just Brazilian players?
No, actually, I'll try
No?
to rescue it and send to you. No. Yeah.
Okay, I'll follow up on that later. We have a bunch of questions. Let me lead off with a couple that came through the chat, and then I will pass to Fran, and then I've got a bunch of my own. But these are two questions that come from Yvonne. One is, and this is a tough one, but whether it's possible or whether there have been efforts to estimate the effect of disinformation that came from the government. I mean, there are obviously many different factors that went into explaining the outcome in Brazil, but one of them was certainly lies coming from the presidency. Have there been any efforts to estimate the impact that that's had on the number of deaths? That's one question. The second question is just a different topic, whether you could speak a bit more about what we know about the relationship between deforestation and the spread of the virus and infectious disease in general.
Okay. So the first question is it's a very good one and a very tough one. The problem in trying, so let me say, there is a phenomenal work done by a group in the University of São Paulo, in the medical school, the Department of Preventive Medicine, that what they did was to collect every single legislation, statement, decree that was done by the government. And when I mean the government, I mean the president, the ministers, and other people related. And what they did was to establish a timeline of all of those events and basically try to associate this with what was happening in terms of cases, deaths, and more recently in terms of vaccine uptake. Now, the reason it's so hard is, one, it's going to be almost impossible to establish a causality study. So one thing is establishing causality, the other thing is to establish associations. And the reason is, if you really want to measure the impact of disinformation, you can do a macro analysis that you see what was circulating and you see what happens, like right now. The rollover of vaccination among children in Brazil is going very slow. And a lot of people are associating this with all the mess that was done by the president and by the minister, several ministers actually, and parents are confused, okay? Now, that's an association based on everything that's happening. What is the problem of trying to do something more comprehensive is that the disinformation leads to some behavior. And the question is, how do you measure the change in behavior in people, right? So there's some people that look at Facebook things or look at searches in Google. I have some problems with all of those measures because you leave a fraction of the population out of those, but let's leave that aside. So the key challenge is in going to something that is really causal, as I think it's what you're asking, is that you need to understand how that disinformation affected people's behavior. And I know of some small studies that are done where they are randomized control trials and you expose people to the right information, the wrong one is circulating, and then you try to measure if the behavior is changing. So you're doing the opposite. You go in a context where this information is widespread, you disseminate the right one, and then you see the effect. That doesn't allow us to say that the effects are complementary. We can't say that, but it's a way to see to what extent people's behavior can change depending on which information they're fed with. So it's a challenge to do this. But I honestly think that there are things that you don't even need a causality study to be able to say the disruption that those things can create. Oh, the second question, deforestation. So if you look at the past epidemics and pandemics, it's more than 75% of those have been created by zoonoses. So those are viruses that live in animals, and they find a way to jump into the human host and basically spread. COVID is a zoonosis, for example. HIV is a zoonosis. So all of those are zoonoses. Now, if you think of some episodes of Ebola, for example, they are associated with destroying the forest, getting close to the animals, and having the disease jump into the humans. We have several diseases that have been reported in the Amazon region. They never created an epidemic, but there are several that have been reported that they are zoonoses. And I urge you to, if you read Portuguese, although there's papers in English, there is a researcher in the Amazon called Pedro Vasconcelos, and he has published there are dozens and dozens of viruses that live in bats, birds, all kinds of animals, that they live peaceful in those animals, and the animals are living, peacefully in the forest. But because the humans are getting close to the habitat of those animals, then you can have those infections. So we have plenty of evidence that this jump can happen, and we have a few examples when it has happened. So the potential for an epidemic to happen associated with deforestation per se exists. If it will happen or not, it depends on how we prevent those things and how we react to those things when they happen.
Marcia, quickly before I hand the baton to Fran, you mentioned the 2022 election, so you put it on the table, so I get to go there. I think there were very high expectations of the Biden administration in the United States in terms of a change in public health policy. Obviously, there was a big change in public health policy, but there's been a certain amount of disappointment in terms of outcomes for a lot of reasons. First of all, what learning do you see? I don't know how much you follow the teams that are surrounding the main opposition candidates, primarily Lula. I mean, what kind of change in policy are they planning, and how much change can you actually expect, given the number of things that don't change when you change the president?
Yeah, that's a great question. So we don't have much yet on. I mean, the different candidates and their plans are being formed now. And I hope in the coming months, we're going to have more chance to see exactly what's their proposal. And I think the number one is, what do you plan to do regarding the pandemic? So those have not been voiced widely yet. But I think that for the candidates that are well known, because they ran before or because they were present before, I think that there's an expectation that what they would do would resemble things that they have proposed before. Let's put it this way. And we don't know yet. I don't know yet how they're gonna. I'm eager to read their plans. Let's put it this way. I'm eager to read their plans and to see if they're gonna bring something new or bring more of the old. That is probably not what we need now. We really need some new ways of addressing things. If you just take primary care, for example, in the community health agents, it's not the same as it was 10 years ago. It's not. The family health strategy is not the same as what it used to be. So it needs a new format, a new model, a new way of inspiring and incentivizing community health agents. So that's why I say I'm eager to read their proposals, because I am hoping for new things. If we have more of the old, then that scares the heck out of me, because I don't know what can happen in this election.
Thanks. Fran?
Okay, Marcia, thank you as always. Another masterful performance. And really, really informative and really broad ranging. And so I've got a few questions. First of all, following up on some of the things that you said and that Steve asked you about, some of the questions. I mean, I'm thinking about the next pandemic coming from a leap from Amazonian fauna. And I'm thinking, you were supposed to be telling us about paths to recovery, not about how we're going to sink into the next pandemic, but be that as it may. I thought you did a great job in highlighting the nature of the challenge facing the public health system as Brazil comes out of this pandemic. Especially the backlog of late diagnosed diseases, all kinds of the late breast cancers, the non-diabetes treatments. I mean, all these things are going to be major challenges for the healthcare system in the road ahead. I guess I want to ask about two that one of them you sort of hinted at, the other you didn't really bring up, and that in itself I thought was interesting. The first one is about the infrastructure of the public healthcare system. You brought up that some medical professionals have left, they've burned out. Who could blame them, standing on their feet for 2 years while people spread misinformation? But I am kind of curious how you see the capacity of the healthcare system if not only the election produces a candidate for president who takes this all seriously. In addition to that, we all have to kind of hope that there's some pent-up demand in Brazil in the same way that we're seeing there has been in the United States and in Western Europe. I mean, inflation might come back, but there is some possibility for economic recovery after a long period of economic inactivity. So there might be some resources. We don't know how many. We know the deficit is enormous, but let's imagine a happy world where we have a good, competent president and we have some resources of recovery. Setting aside the challenges of the late diagnosed cases of normal non-infectious disease, what do you think, what kind of shape is the infrastructure of the SUS in right now? You say it's not the same SUS as 10 years ago, as 5 years ago, but like, how badly off is it? How many more doctors need to be trained? How many more nurses? How many more community health workers? Roughly, I mean, like what kind of infrastructure are we looking at? Secondly, I wanted to ask about something you didn't bring up, and that's trust in the healthcare system. When you have a lot of disinformation about science, people start not trusting doctors about anything. I listened to sort of banter around the United States, and it sounds like the old immigrants that I grew up with talking about how doctors don't know anything and they don't believe anything the doctors say, and the doctors just want your money and why bother going to a doctor? And I'm wondering if there's been, and one thing that I found heartening about Brazil relative to the United States was that you had a president that was spreading just as much disinformation as our previous president was. But the minute the SUS said, okay, we've got vaccines now, it's time to get vaccinated, Brazilians lined up all over the country. Within 2 weeks, half the country was vaccinated. So I'm wondering if there's a higher level of trust in the SUS than there is in sort of the medical community in general in the United States, or if you have seen an erosion in trust in the SUS. Of course, people are going to complain about wait times. Who can blame them in a way? But even if the blame is misplaced, people get frustrated. But what do you see about the infrastructure? What do you see about the level of trust in the SUS? And I've got a totally different second question. When you put up the maps of inequality and access to healthcare, to vaccines, it's not a surprise to see that the southern parts of the country, the Southeast and the South, have higher vaccination rates than the North and the Northeast. It's not a surprise to see the wealthier parts of Sao Paulo have higher rates of vaccination than the periphery. But there was one big surprise in the map, and that was Piauí. Piauí had the same vaccination rates as Sao Paulo, better than Minas, better than Rio. And I like to ask puzzles. And I like to think that sometimes in the answers to puzzles, we find the answers to problems that might otherwise seem intractable. As much as we try, we can't solve the problems of Brazil's inequality overnight. But maybe there's some hope coming out of Piauí. So how do we explain what happened in Piauí that the vaccination rates are so high there?
I was expecting somebody to ask that. Okay, so let's go. First, the infrastructure. That's a great question, Fran. And so you probably remember that the Mais Médicos was ended, right? It was one of the first things they did. And since then, they created a new program called Médicos pelo Brasil, okay? Now, they created the program and they never had a call for physicians to apply to then be assigned. The first call happened recently, just now, okay? And the call is for, it's either 3,000 or 4,000 doctors. Now, just to recall, Mais Médicos had 17,000.
Yeah.
Okay, so just in terms of magnitude, what is being recruited for this program, that in theory will do the same Mais Médicos did, which is to redistribute and to send physicians to places where we don't have physicians and where it's very hard to keep the physician there. It's a joke. I mean, what are you going to do with only 3,000 or 4,000 before we had 17,000? So that's one thing. We have more shortage of doctors compared to nurses. We do have nurses. But as you would know, the sort of group of physicians, they're a very strong group in Brazil. And there's so much that a nurse can do. A nurse could do much more than what is allowed by law. If only physicians would just, recognize that the nurses can do more, and then we could fix some of the things with the availability of nurses. And then honestly, what we need is to bring back those programs. They used to pay well, and we need to bring back those programs. And if you think about that, about 70% of the healthcare coverage that was lost with the Mais Médicos was among indigenous communities, where we see the problems now, very high infant mortality, hunger, all the crazy things that we shouldn't see anymore. So we really need to think about how either the programs we used to have or new programs will bring the healthcare professionals where they need to be. And also, I think that has an overlap with your second question about trust. Think about indigenous communities, quilombolas, or other places where the physicians don't even look like them. The physicians don't know their knowledge, don't understand their culture. There is an issue of trust in there. If you look, and this goes into healthcare, but also go into politics, right? Look at the composition of Senate and Congress. They don't resemble the demographics of Brazil. Why would I trust them? They don't look like the majority of what Brazil is. So there is a sort of an intersection about better distribution of those resources with incentives that used to be in place, and they can be rethought with trust. And here I would say another thing. I think we're missing the boat on leveraging technologies like telemedicine. And this could go a long way in some places. And I don't think we're even close to what we could be using in terms of those technologies. Trust, I couldn't agree more. I mean, the interesting thing that happened is the moment the vaccines were available, and I'm sure you know this, people that used just to say horrible things about the SUS, those are upper middle class, and they would take the vaccine holding a sign talking about SUS. And so suddenly everybody looked at the health system and recognized the importance of the health system in Brazil. I think that people trust this delivery because we have a history of delivering those vaccines through those programs, but we have something happening in Brazil now that is really worrisome, is we have groups of physicians that still prescribe the chloroquine and ivermectin still now, 2022, okay? Those are physicians. Those are physicians. So we have people reporting, well, I went to the physician, they prescribed me that. Should I take this? So people get confused. So it is trust, but it's also this, what should I do? If a physician is telling me to do this, but everybody's saying that that doesn't work, what should I do? So it's more than just trust. How should I say this? You don't know who to trust. Let's put it this way. It's not that you don't believe in the health system, but you have conflicting messages coming from population groups that until a few years ago, you should believe them because they're physicians, right? So that is a problem that I see happening now. I don't know at what point this can create distrust in the health system. I hope it won't. I think the distrust is with leadership, and there's a lot of confusion. But I think that people still trust the health system per se as this institution that is able, like now, to deliver all the vaccines as it's doing. Now, there is an issue going on, which is the vaccination among children has going much slower than it should. And, there was a delay of more than a month because of all the craziness. We're going to listen to the public. Then they buy fewer vaccines than they should. And they, in the beginning, they were saying parents have to go with children. They have to give an authorization for the child to be vaccinated. All kinds of crazy things happening. So again, I think what this is creating is this confusion that parents are not sure if they should take the child to be vaccinated or not. And this becomes even higher among people that still, follow the ideas of this government. PLE. So we have a few examples in the Northeast, actually, that if you just look at the usual indicators, you would expect those places to fare really bad. And honestly, Fran, this is leadership. This is going against the tide of what comes from the federal level and doing what has to be done. And you see different actions happening across Brazil. You have cities where people put on the weekends, they go out with a car with a sound system, asking people to come and take vaccines. There are other places that you have community health agents sitting on a desk on the phone every day, calling people to come back. And you have to take the first dose. You were late for the second dose. So when you put together all those initiatives happening, you see those things that, well, why is this place so high? They usually have very high inequality. But again, go back to the very first slide I showed, you're not on the same boat, but you're in the same storm. Some places are going, far beyond what you would expect to do the right thing. So that's why PLE had that high number. Sometimes you have this massive effort to vaccinate, and then, in another week, you could have another state that jumps out, increases the coverage of the vaccine. But this is a clear demonstration of taking the actions that they should, having vaccination on weekends over hours so people that work can actually go. The contrast in the Amazon is we have different groups, unfortunately, basically telling people not to vaccinate. And in some places, this is connected to the church, to the Pentecostal church. Not all of them are doing this, but there are several examples of pastors telling people not to vaccinate. It's the alignment with the federal government. So I'm horrified to see those low coverage, but to be very honest, I'm not surprised.
Thanks, Marcia. A couple more questions from the Q&A. One question asked, what are the sources of a push for, or the sources of greater demand for equity in the public health system? And specifically, what role has the World Health Organization played in catalyzing demand from within Brazil for greater equity in the health system? A second question is whether in Brazil or elsewhere, there's a risk of what the questioner asked, described as a paradox of success, whether the fact that people feel protected, they're vaccinated, and begin to let down their guard, whether that will actually slow progress in combating the.
Okay, great question. So the first one, it's interesting because there is so much that the World Health Organization can actually do. I mean, they issue protocols and all of this, but they have no mandate on telling countries what to do. It's important for us to remember this. Sometimes people think that the World Health Organization can do a lot, but they can't. And in fact, when you think in terms of equity in health systems, I think the first time this idea of health as a right, at least in the context of WHO, I'm not going to have the year right, but it was in the 50s or something that this idea came up. But Brazil actually put health as a right in the constitution back in '88, and organically through the popular movement, this idea of the health system having equity as one of the pillars was established, not because any organization told Brazil or because the health organization worked with the government. No, this came from the different movements that were happening, the physicians, people working in public health that put this together. So just to make this distinction in this question. The second one, it's interesting because I just wrote about the paradox of success. That happens a lot, both in prevention. So I mentioned prevention. And one of the things with prevention, or when you're doing a disease control, like or you're doing COVID control, the paradox of success is when your actions work, nothing happens, right? So the issue of the with prevention or with control is when you're doing the right thing, it's invisible. There are no deaths, there's no drama, there's no headlines, there's nobody complaining. And as crazy as it may sound, this invisibility becomes a problem because people may say, well, why should I keep financing those actions if nothing is happening? Why are you investing all this money if nothing is happening? And then I think that what's happening with people is a combination of maybe this is gone, but also people are tired. And again, we have no mass communication campaign. We don't discuss issues enough. And we have the disinformation circulating. So when you put all of this together, a little bit can be the fatigue. I'm not sure how much this is a paradox of success. It could be connected to vaccines. If vaccines are successful and you have fewer deaths, then people may think it's over. But I wouldn't connect this idea of paradox of success with the COVID pandemics per se, particularly in the context of what is being done to contain the pandemics, because what's being done overall is a disaster, right? Thank goodness we have the vaccines to prevent a much serious case. But the paradox of success is something that affects everything we do in public health, for sure.
Marcia, I'm going to ask you a ignorant question from a political scientist. One of the most depressing things about observing the pandemic and pandemic response in Latin America has been watching the outcomes, at least from a distance, in countries where governments actually responded pretty well. So my question is, how much difference does not punting make? As you know very well, Latin America was in many respects a perfect storm for COVID, high urbanization, very high levels of informality, high levels of inequality, large extended families, pretty weak states in many cases. So this is a place where it was going to be very hard, even for the best intentioned government. And Peru and Argentina and other countries that really did, where governments did not punt, you get outcomes that are almost as bad as Brazil and Mexico. So given that, what were the public policies that actually made a difference in Latin America in this context? And did we see them in particular states in Brazil where outcomes were? We talked a little bit about highways vaccination, but where public policy actually was different and made a difference.
So there are a few examples, right? So if you go back to 2020, right in the beginning, and you look at what Uruguay did, for example, right? So before,
but Uruguay's easy.
Okay,
Uruguay doesn't have all the conditions I just listed.
Okay, all right. So let's think of another one. Okay, so let's take Peru. Okay, Peru tried to respond to what could have happened, and it created, it imposed a lockdown, not lockdown, but it imposed some physical distancing measures. And that was well-intentioned, but it lacked some social assistance connected to that, right? And what was the problem? You have a very high percentage of the population that don't have a fridge. So people had to go out, and they were going out to the markets. So all that they wanted to do in anticipation of a problem end up creating the problem, because people had to go and everybody was going to those markets, and then things exploded. So here's an example of trying to respond, but if you don't have some kind of social protection, and those were like emergency funds or all of those things that for the most part in Latin America they happen, but they happen later. Take Brazil. It took a long time for the social emergency benefits to be put in place, and then they ended in November 2020, and in 2021, when things were completely out of control, the worst moments of the pandemic, the population didn't have the emergency benefit. So I think what we can learn is we have fragments of trying to do the right thing, but ignoring exactly the context you described. In other words, if you're going to have those actions implemented, you need to think that not everybody can do physical distancing, not everybody can work remotely, not everybody can study remotely, and people are going to need assistance in terms of emergency funds and food. They're going to need that. So did that happen anywhere? It happened in small localities, and those were the responses we had in huge slums communities in Sao Paulo, in Rio. In those places, they were sort of protected a little bit with the actions that were being done by combinations of the local community, philanthropy, institutions that were providing food, medical care, assistance, some funds, just voluntarily. So I think we have some sort of microcosmos of different examples happening in Brazil. I'm sure there are in other countries in Latin America as well, but they are not representative of what happened broadly. Here's another example. There were some places in the Northeast. There's Ceará is an example. The government took an entire plane, flew it to China to bring masks and respirators at a time when there was nothing in the market. They decided to do this, and it made a difference for their hospitals and at least temporarily. Now, the federal prosecutor wanted to sue the state for having done that. So they tried to do the right thing, and they were almost sued by the government for doing this. Now, can every state do that at a time when you had no masks in the market, you had no respirator to buy? They did it. Not everybody could do it, but they did it. Now, what happens is it reaches a time that you may be trying to do the right thing, but what's happening in the neighborhood of your state? What's happening around? The connections are still in place. The flights are happening. All the networks of transportation, commerce, those were not interrupted. So it doesn't matter how well of a job you do, just those connections are going to end up helping the circulation of the virus anyway. So it's kind of a tough question, but the point is, if there was a coordinated effort at the federal level that tried to anticipate, so we never try to buy more tests and be prepared to have testing in place, or expand the hospital bed. So there's one place in Sao Paulo, the University Hospital, that they anticipated the problem. They opened 300 beds, and that's one place that they never run out of beds, no matter how bad the epidemic was. But they started way before knowing it was going to be a problem, right? So we have some of those examples. Could we have done that in the entire country? Probably not. But without some federal guidance, then everything just becomes much, much more complicated.
Marcia, as a political scientist, I've learned never, ever, ever predict, but I'm being asked to ask you to predict. How long is COVID going to be with us? 10 years, 100 years, forever? What do we think? What do we know?
You just said we shouldn't predict, and then you ask me. Look, it's hard. I mean, it's at this point talking about eradication, which is if it's gone forever, probably not. Will this become like the flu that keeps mutating and then we need to adapt the vaccines? That's the hypothesis for some people. So we really don't know, but I think what we know is, considering that vaccination rates in Africa are what, less than 10% still, this is just shameful. And what we should be doing is really to guarantee that the circulation goes at very low levels, because we do provide the vaccine to the population. So we reduce the chances that the virus is going to keep mutating. We're going to have new variants. That's what we should be focusing on. So if we don't do this, again, if we don't have more empathy, more solidarity, and get those populations vaccinated, then I can't see how this is just going to go away by our own fault, honestly.
Absolutely right. I need to close. Before I do, though, want to announce a couple of really exciting panels that we have coming up. First of all, this Thursday at 3 p.m., Dr. Class is co-sponsoring with Columbia University a panel on the crisis of democracy in Central America. We'll have four really outstanding analysts of politics in Honduras, Guatemala, Nicaragua, and El Salvador speaking, and in addition to that, Terry Carl and Deborah Yashar as discussants. You can sign up for that at the Dr. Class website. And next Tuesday's seminar will be a panel on the roots of polarization in contemporary Latin America, asking the question of why politics now in Latin America has grown so polarized. And we have four really superstar speakers, so I encourage you to come to that. Dr. Marcia Castro, many, many thanks for joining us and sharing your insights and your thoughts today. Also, thanks to Paula Ibarra and Jillian Scales for your wonderful technical support. Thanks, Fran. We'll see everybody next week. Take care.